Our next guest heads a company that's beginning to trade on the NASDAQ today. Indivior. It develops pharmaceuticals to treat substance abuse disorders and mental illnesses. It's unfortunately a big business, but a business for which it is a growing one. Indivior CEO Mark Crossley joins us this morning. Good morning to you, Mark. As I said, you know, in a perfect world, a company like yours wouldn't exist. To the public who may not know about your company, what substance abuse issues are you trying to combat?
And thanks for having me today, Andrew. We're a company that was founded to help people suffering from addiction. Founded over 20 years ago, focusing primarily on opioid use disorder, but we have drugs and products in the pipeline to help with more normalized diseases also, such as cannabis use disorder, alcohol use disorder, and stimulants. So unfortunately, as you said, you know, we read about the opioid epidemic every day in the press. You can't go anywhere. I think most people have someone in their family, their community or friend network that have been impacted by this. And we're a company that's here to help those patients. So many other stakeholders, due to the stigma, due to the nature of the disease, the tough science, have left these patients behind. And we've been solely focused on trying to help them find recovery.
So let's talk about the opioid epidemic in this country, which is to say, do you have, from a policy perspective, do you have any view of where we really are? And to the extent that there are medications, things that you're developing and others to solve this problem, or at least to mitigate this problem, where are we?
Yeah, it's a great question, Andrew, because, you know, in the United States, such a developed country with a great healthcare system, you know, less than 20% of the patients, you know, less than 2 out of 10 people that suffer from opioid use disorder are actually getting some sort of treatment. So it's an area that, whether it's stigma, you know, whether it's a lack of awareness, people just aren't getting in for treatment. Now, I think the positive sign of this, it is one of the few bipartisan issues that we see, and there's a lot of efforts going in, you know, to help normalize the space, open up access, and break down barriers. We have record funding for addiction now, over $6 billion, and the laws have been getting implemented to help break down the barriers and increase access. So we're hoping, you know, over the next 5 to 10 years that we'll get more patients into treatment.
What is the cost on your end for customers or consumers who are going through this right now in terms of dosage or for a dose, and how long would you be on this medication as you're trying to get off of opioids?
Yeah, it's a great question. And I think the good part about this medication is there is broad access. We have a once monthly medication. So every 28 days, you know, you have to get an injectable drug that keeps a very constant therapeutic level all day long. It changes from the daily dosing that was there. So we've reduced the choices from 365 choices a year to 12 choices a year to remain in treatment. The good thing is the insurance companies, we have almost 90% of lives covered, which is really, really good for drugs, right, and offer, you know, patient assistance via copay programs so that
and what is the cost typically both to the customer and to the insurance company?
It's about $1,900 a month for treatment.
So that's a very expensive cost. I mean, and that's a big, I mean, it's great for your company, but a big question, I think, long term in terms of how big the market is for this, right?
Yeah, I think the key here is focusing on this disease. A patient that's in treatment, you know, is saving companies money. You know, they're avoiding emergency room visits. They're avoiding relapsing, and we've got great coverage with those insurance companies because they know that having a patient in treatment, right, you know, is beneficial to them. It saves them money. And it helps those patients find recovery and regain their life, which is the most important part.
And Mark,
of this.
we got to run, but the one final question, which has to do with cannabis. You said at the top that you're dealing with cannabis disorder. Explain what that is, because I think there's a lot of people in this country that think that cannabis is not a drug that can create these type of habits and is not a problem. I mean, it's obviously being legalized in huge parts of the country.
No, absolutely, Andrew. And as it's become medicalized and legalized, it's high THC sort of levels of cannabis. You know, you're talking about tinctures, smoking, gummies, you know, that are normalizing the disease. And what we're seeing is a higher instance of people addicted to cannabis and having cannabis-related disorders such as psychosis. And we have an early stage product, you know, that is quite promising, you know, that we're looking to bring to market to help people, you know, with this cannabis use disorder.
For those of us with kids, do you consider cannabis a gateway drug?
I consider cannabis as a drug that can really cause addiction and start with patients. For my kids, I do not recommend it, and we're here creating, a product that we think can help people that end up getting addicted to it and having it take over their lives.